Uh, Good morning, everyone. Happy Wednesday. Today, as our guest speaker, we have Ken Hill with National Care Dental, one of our premier dental partners. Ken is the account executive for National Care Dental. Um, National Care has one of the best marketing dental plans out there. They have a $10,000 dental plan. And I always say, if you talk to me, everyone should have a button made that says, please ask me about my $10,000 dental plan. It's one of the great conversation pieces that we can have and we can promote, and it will get conversations. Even if they don't want the $10,000 dental plan, if they look at it, it's a cost deal. They have other dental plans that are phenomenal, and they're part of an association. So they get so much more benefits than just the dental. Even though the dental is amazing, which Ken will go over, I'm not going to steal his thunder, but it is a great product to have. Always check your availability. If you're not contracted, get with your regional manager, give me a call, get with us, and let's get you going. But it is a great product. It is a dental plan, like I said, that is, like I said, multiple facet because you have a lot of different areas that it can be used in. And like I said, no one has a $10,000 dental plan, and that in itself, from a conversation piece, is fantastic. So here is Ken Hill, and Ken, thank you again. I'm going to turn it over to you, and again, thank you for joining us, and it's all yours, Ken.
Awesome. Hey, I appreciate it, Joey. Well, thanks everybody for having me on. I'd love to take a few minutes of your time today to really get our dental plans out there, but not only the dental plans that we have available in the market for anybody 18 and older, but also who NCD is and how we can benefit you as the agent, as the broker, and taking care of your clients. So you should see as long as the PowerPoint's up there, we'll get started. So quick introduction. My name's Ken. I come from not an insurance background, but I come from a decade in the Army. I was teaching at NC State for military science, and then I had a mutual friend and introduced me to NCD, and I haven't looked back since in the past 2 years. So great company. We have some great stuff for you, and this is really a great partnership with the teams with Joey. So with that, a few things we're going to run through today. We're going to talk about NCD. Who are we? Why dental? Why some statistics behind dental, and why you should be offering it to your clients, even if they have a Medicare Advantage plan already or whatever it may be. Dental is key to your portfolio. We'll talk about the products, of course. I won't read super deep into the brochures. I'll pin that here for you to look over later, but we will talk about the selling points of the products. We'll look at a live enrollment on the portal. We'll talk through any questions you have, right? All right, let's get into it. Who is NCD? So I like to start all of these trainings, all these meetings with our mission statement. So NCD exists to improve lives by driving better health, exceptional experience, and spreading a smile. Now, this is something that, our mission statement that we bring to the table every day when we do multiple of these trainings or we have any meetings. We like for everyone to know who we are, not only with the products that we have, but the company that is backing you. And our mission. So we bring this to life in 3 different ways. So we create innovative products to serve the needs of your clients. We are hyper focused on not only you as the agent and making sure you're taken care of, but also your members, right? So helping you take care of them, which brings longevity, which brings residuals and a happy client. And we provide that top tier support to you with our agent support teams. All right, so when it comes to developing new innovative products, and hopefully this coming fall, we'll have some different products outside of just dental and vision, but we're doing things a little differently than other companies. So we partner with well-known carriers to create unique, robust products. So we work with companies like MetLife and VSP. So this is a true partnership with these companies, right? We are co-creating products on their paper, and then we handle the member support, the billing, sales, agent support, anything else you could think of. So MetLife, for example, they house the network. They process the claims very quickly, and then we do everything else. So through these partnerships, we've been able to, and as Joey mentioned, the association backing, create some very robust dental products that aren't common and aren't out there in the ancillary insurance space. We have created our core plans, our value essentials and complete, and then our newest product set with NCD Elite, which has a $1,500, $3,000, and $5,000 option. And of course, VSP is our preferred vision plan. It is custom to NCD, and there's nothing else out there like it. So we'll dive deep into the specific product details in a little bit, but just know that by partnering with NCD, you have access to 6 dental plans with rich benefits, and annual max options ranging from $750 to $10,000, and all of which are backed by amazing brands that your clients already know and love, right? MetLife and VSP have been around. It's easily recognized. So let's move into our member focus. Well, Ken, how do you help our members? That's a great question. So this is really where we deliver on our mission statement. If you see the bottom there, this is something I take a lot of pride in. We have a separate group chat that's company-wide on Teams. Every day we celebrate multiple 5-star reviews that come in for our member care teammates that are directly from the members, right? So very motivating, very good way to celebrate throughout the day. Our member care team answers the phone in an average 15 to 18 seconds, right? That answer time is very quick for the industry. They reply to email within under an hour. They outbound dial 10,000 or more times a month, solely calling on new members or your clients, saying, hey, welcome to the team. If you have any questions about your plans, please let us know. They even go as far as walking through scheduling their first cleaning for them, finding an in-network provider so they have a great experience. We're really there to take your client under our wing as well, right? Which, again, creates that longer relationship, make sure your client's taken care of and they're using the dental plan that they signed up for. Same thing with agent support. So speed to response, under 30 seconds for a phone call being answered, under 2 hours for an email reply. You have my team, the account executives, where we help with the webinars. We help with whatever it may be, any sales support you need, any marketing ideas you have, please feel free to pass them through us. We're here to help you make money and take care of your clients. You power everything we do at NCD. If we didn't have you offering our dental plans, we wouldn't have a company, right? And we want to treat you accordingly. So again, outside the products, it's important that we're creating additional products in the future. So if you have any product feedback or anything that we can do to partner together and create something new, please don't hesitate to reach out. And also commissions, level for life. So as long as that client stays on board, then you're getting paid, right? So we'd love to help with that. Make sure that you're happy as well. All right, let's switch it up a notch. Let's talk about why dental. So it's important to spend a few minutes on this because we could read through brochures. I could screen share with the detailed product brochure, but the really why behind dental isn't always on the forefront of our minds, right? It's that Medicare Advantage plan or that critical illness accident plan, whatever it may be. It's as simple as, hey, I see you have teeth. Would you like to hang on to those, right? It's an easy question to ask. I probably don't need to tell you that inadequate dental insurance coverage can lead to poor oral health, and we'll touch on that here in a minute. But what I do want to point out is that poor oral health doesn't just impact their teeth and gums, but it impacts their overall health as well as financial stability, right? We all know dental insurance is not cheap. So a few things I want to touch on. Poor oral health can lead to an increased risk of cancer by 24%. You're twice as likely to have high blood pressure and other health issues such as rheumatoid arthritis, dementia, Alzheimer's, a lot of bad stuff that over time will definitely deteriorate your overall health. Another one here. So according to the CDC, over $45 billion is lost in productivity in the U.S. each year just because of untreated oral disease. If anybody wants to take a guess on why that oral disease goes untreated, we're about to look at that. It turns out pretty widespread. So 60% of adults over 65 are affected by periodontal disease. 90% of adults over 65 have a cavity. And this is probably the most interesting, ties back. 80% of adults that have unmet dental care cite cost as the reason for not receiving that care, right? Dental work is expensive. That's why we have to find your clients great, robust dental plans, as Joey mentioned, up to $10,000 in coverage so that they don't have to pay out of pocket. So dental insurance isn't just a nice to have last minute when you have a toothache. It's a clear need for your clients over time. They need dental insurance for their overall health and the financial wellness. All right, so we're going to dive, again, switch up a little bit. We're going to dive into our product portfolio, looking first at our dental plans and then our vision. So we have two different product sets, as I mentioned earlier, each with 3 choices. If you're tracking with me, you know that you have 6 plans to offer. That's a lot of choices, right? We don't always know which choice is best, so we'll also touch on that. What to sell when, what situation will come up. We'll go in depth about what they have in common, different benefits, and ultimately how you can choose the right plan. So as you can see on the screen there, you have your core plans on the left with the $750, $2,000, and $10,000 annual maxes. And then right there, you have your elite plans with the $1,500, $3,000, and $5,000 option. You can see here we're available in 40 states for dental and 49 for vision. That's not overlaid there on the map, but anything in blue is available today to sell. New York and Connecticut are pending the elite products as of last week. So we're just waiting for those to go through. But yeah, everywhere in blue is available to sell. Anywhere in gray has either said no, as in Washington, or are still pending approval. And Joey, I know you brought that up earlier. So Washington is the only state that's outright said no. All right, here are a few common features across the board with our dental plans. I know there's 1,000 dental carriers out there. There's 1,000 products available, all different intricate benefits, all different availability throughout the U.S. It's hard to navigate sometimes. That's why we try to make it as easy as we can. All of our plans are guaranteed issues. So there's no underwriting questions. When we run through the application here in a little bit, you'll see that everybody qualifies for coverage. Doesn't matter if you're 18 or 180 as we develop modern medicine. There is no upper age limit for your seniors. There's dependent coverage from birth and on. There is no age banding, so it doesn't matter if they're 20 and a male or 85 and a female. It's all pricing based on zip code, so they're going to pay the same price. One enrollment platform. Again, we'll touch on that here in a little bit. You'll see how easily navigated that is. And then all of our plans, again, are backed by an association with the NWFA. And we'll touch on that here in a couple slides on what those benefits are. All right, here's a quick snapshot. So it's scrolling here, but you can see we have Dial Care, which is a great one for your clients. So it's a urgent care telemedicine. So unlimited usage, $0 copay embedded in a dental plan. You don't get that. That's not common, right? A ton of other different add-on benefits here. CleverRx. We have discounts on travel, hotel, roadside assistance, 1-800-Flowers. There's a ton of stuff here with over $100 a month in added benefit. Again, we'll link that here today for you to check that out. But just a ton of added on stuff there that you don't get with a dental plan. All right, let's take a look at our core plans. So if you've been with us for a little bit, contracted already, or if you've heard of NCD by MetLife, this is the core plan. So they've been around about 2 years now, and they range in annual max. So you have The Value, which has a calendar year $750, Essentials has a $2,000, and the Complete plan, which is our most common or popular plan, is at $10,000. All three levels of core plans have 100% preventative care, not subject to the deductible. Preventative care, you're looking at routine exams, routine cleanings, 2 for the Value and 3 of each for the Essentials and Complete. You have fluoride coverage for kids under 14. Basic and major care categories have graded benefits for all three plans. That means that they get better with time. You can see the co-insurance amounts for all three plans there at snapshot. If you're not familiar with dental, so basic care covers full mouth x-rays, sealants for kids, space maintainers, restorative fillings, periodontal maintenance, simple extractions. That's a huge one there, right? Simple extractions is a very good benefit for the basic services. Note that the Essentials and Complete top out at 90% coverage. That is really high in the industry. Usually you're going to see a max of maybe 80% co-insurance for basic services. For major care, the Value plan does have a waiting period for 12 months. And during that first year, those on the Value plan will still get taken advantage of the in-network discount, which is huge. And we'll touch on that here in a few. And then the Essentials and Complete begin day one at 10% major care coverage, and then topping out at 60, which is higher than the industry average as well. Major care does include complex extractions, oral surgeries, crowns, endodontics, periodontics, dentures, implants, bridges, denture repairs, all that good stuff. Implant coverage, I do like to note, is covered at $3,000 per calendar year. So again, calendar year, it renews every January 1st. There is not a lifetime max, so you'll have $3,000 per year towards implants. So, for example, if your client is in year 2 at 50% coverage and needs an implant, the plan will pay 50% coverage up to $3,000, which is allowing for a $6,000 bill after the negotiated rate has been applied. So maybe enough for 2 to 3 implants a year. So just to reiterate, recapping for the core plans. So graded benefits, they get better with time. So the longer the client stays on, the more benefit they get for their dollar. No waiting period on major services for our $2,000 and $10,000 plans. You have your $100 lifetime deductible on the Complete plan, which is great for retention. And then our New York and Connecticut plans, just to note, are a little different. They have slightly different co-insurance amounts. And I'll, again, link the Agent Launchpad so you can refer to the differences there. All right, our elite plans are a little bit more simplified compared to our core plans. So with core, we saw some variation in benefits between the 3 plans. But with the elite plan, you have 3 annual max choices, and then all the benefits are the same across all 3 plans. This is more of your traditional style dental plan with preventative covered 100% day 1. Basic services is at 80% day 1, which is super high for the industry average, right? And we'll talk a little bit more about that here in a few. Our major care is covered at 10% day 1, just like the core plans, with 50% co-insurance in year 2 and beyond. Deductible, $50 per person, and then a max of $150 deductible per family per year. So for preventative service on the elite plans, same as core, right? Routine exams, cleanings, x-rays, fluoride. Basic care is the same as core as well. So full mouth x-rays, fillings, which include the resin fillings for all teeth and crowns, sealants and space maintenance or maintainers, for kids under 14. And then your major care, again, the same. So there are oral surgery covered crowns, endodontics, periodontics, dentures, implants, bridges, the whole 9 yards. So some of the highlights of the elite. Again, it's easy to understand because it's consistent benefits across all 3 levels. Your basic services start at 80% day 1. Simple extractions are covered under basic. Implant coverage is available on all 3 levels. However, there's a caveat. There's a 2-year waiting period for implants, and then you'll get 50% of the annual max towards implant-related services. All right, let's talk about network. This is probably the biggest part of this entire training, is the network education. And there's a few reasons why. So it is a solid network. It's housed by MetLife, so it's the same as their group plan. Has 250,000 providers, a little over 600,000 access points. Providers can be located on our website and enrollment portal, which I'll show you here in a few minutes. And then we have the highest network discount out there for dental. So on average, 35 to 50% off the street prices is the negotiated rate. But that's huge. Just to give you comparisons, there are there are networks out there with well-known dental products that may only have to offer a 5% discount to be considered or to be in network, right? So that's a very high negotiated rate with MetLife. Dentists will also recognize the MetLife brand, right? So we are clients, as we talked about earlier. The brand recognition is a challenge with a lot of other products out there that are rolling out. MetLife again is the network and claims payer, so this will increase recognition by the dentists. Again, we found that on our end and feedback from agents, network education with the clients is key. You don't get the negotiated rate if you go out of network. Now you still can, and we'll still pay out of network bills or with the client being balanced billed, but their out-of-pocket savings is going to be huge as far as that goes. Let me give you a quick example of in versus out of network. So you can see here with the negotiated rate or the maximum allowable charge, it's a MAC-based plan. The crown only costs $1,000. So say the negotiated rate in network is $500. Then our plan pays out the co-insurance level of 50% for major. Say for this example, then the client's left with paying $250. Whereas out of network, say they charge the same amount for the crown, the negotiated rate goes out the window. We still pay $250 because we pay, our co-insurance is the same percentage. However, we pay what we would have in network. Right? So you can really see there where those bills can add up for the client if they're going out of network. All right, I know that was a lot. We just went through 2 different styles of plans, 6 different options total. Can seem like a lot to sift through, but we'll take a look at now with addressing what the client needs and going from there with which plan to advertise or to give as an option. The bottom line is that some of your clients need some sort of dental coverage. Luckily, you have options with us all in one place. So let's start with the main need. Are they looking for preventative care? They have a healthy oral status, but they just want to maintain that. Do they need basic services? They need extractions right away, for example. Or are they looking for some of the big stuff, right? They have a pain in their mouth and they need complex extractions, all that good stuff. We'll see what they need. So for preventative, you're looking at your value, your $1,500 or your essential. So the $750, $1,500, or $2,000, just to cover those preventative needs and keep a lower premium. For basic services, you have your $1,500, $3,000, and $5,000, right? So this is a no-brainer. We saw earlier, to reiterate, 80% co-insurance coverage day one, right, with basic services. If your client needs, if the primary need is a major service like a crown, for example, but they don't anticipate needing an implant, then you really have a lot of options. You'd want to get enough annual max. So I'd look at the Elite 3000, 5000, or the complete plan with 10,000. All these have good annual maximums with major services covered on day one. And then, of course, as we talked through earlier, if your clients come to you and they say, I need implants, then NCD Complete is a no-brainer. In addition to high annual max, you're looking at no waiting period for the major services and the $3,000 that resets every year towards implants. Awesome. And Joey, I can't see if we have any questions or not so far. We can definitely pause for a second and address any.
No, so far so good. Pretty straightforward. So no, you're good to go.
Awesome. So our vision plan, I won't take a long time on this. It's very simple, very straightforward, and can be pitched to a client in a minute or two, right? So some touch points here. Our VSP preferred plan is custom NCD. So you're looking at a $20 copay. You're looking at a few other highlights. So up to $220 in frame allowance. And then you also have $150 for contacts. Now it is switch or one per year. So we do recommend to get your bang for your buck off the bat using that frame allowance first and then rotating over to the contact allowance in the second year. We do have progressive lenses offered at a $50 copay, which is huge for our seniors. It takes that line bifocal, trifocal out, makes it a smooth piece of glass. That's a huge hit. You're looking at paying, $175, $200 or more for those progressive lenses. And we offered at a $50 copay. You also have some other lens upgrades, lens enhancements there. Our discounted rate through VSP's network, of course. And then discounted rates off of LASIK as well. So a lot of added benefit there with that plan. All right, I'm going to stop sharing for a second. I'm going to bring up the portal here. Maybe.
While Ken's bringing that up, I want to say a couple of things real quick, and I always like to give a little review on, what's being said. A lot of times the main part about a dental plan is the network. And when you have MetLife as your dental network, I mean, that's just fantastic. And you can go in there and show them, and it's MetLife, brand name recognition. It's just such a strong asset to have and to be able to show your clients what you have as a partner into your dental plan. And on the vision side of it, a lot of the vision parts of dental plans are just discounts. When you're able to put in a true vision part into your dental plan, a lot of people are wanting vision. They're needing glasses, contacts, all of that. So the vision part of this is fantastic. And whether it be the core, the comprehensive, or the elite for the lower cost, it all just, like I said, you have so many different levels to be able to fit what Ken just showed you, to be able to fit your client's needs, whether it be benefits, whether it be price, because you dang sure have the network. So, and you have the part of the association. When I was doing some trainings early on, I was talking about the extra benefits just as strong as the dental plan itself. When you have all those extra benefits at your disposal, do not dismiss those. That is just as strong and it's just as being a part of your dental plan. Look at what you get for your premium. You get all of these great benefits as well. So all of that being incorporated just makes everything a lot more strong and a lot more complete when you're talking about the dental and the vision and everything else. And they also have. Do you still, Ken? Do y'all still have the partnership with Direct Smile Club for the braces aspect?
Yes, we do have a discount on those orthodontia as well. We don't
Perfect.
have orthodontia covered,
Correct.
as a traditional benefit of our plan, but yes, we do have discounts on the Invisalign. That's the name.
Invisalign. Yeah.
The Invisalign type stuff. So yeah.
That is fantastic. I mean, now you can have a good discount for that. So you have all your bases covered. That's what makes National Care Dental such a great partner, because you have so many different bases covered, and it just gives you so much ammunition to be able to take care of what you're trying to do. So if you're ready, Ken, I will stop talking.
You can see my screen, right, Joey?
Yes, sir. Yes, sir.
Awesome. So I'll give a quick run through and show you the how streamlined our portal is. So this is just, if you're already contracted, you should have your 6-digit agent ID. If you're not contracted, we'll get you one when you do. But it's just enrollment.ncd.com / your 6-digit agent ID. So each one of these are custom to you, right? So when you sign up, you put your phone number, your email. That's something that will be client facing as well. something I do want to touch on real quick. So you see at the bottom here, if you have a client that's skeptical, well, who's NCD? Who are these products through? Is it actual good dental insurance? Feel free to click on our Google review link at the bottom. So these are updated live, right? When you can show your client 2,800 almost 5-star reviews, it definitely backs, your opinion of the products and helps that sale process as well. And Joe, if you don't mind, throw me your zip code real quick. We can use that.
76001.
Awesome. So as I mentioned earlier in the slideshow, all of our products are based on zip code. So first you put in your zip code. First question will be, I'm looking for dental coverage. Yes. You can stack vision on the same application with a click of a button. You could do dental only. You could do vision only. Either way, you scan it there. We'll select dental only. So again, to reiterate, anybody 18 or older can be a member on the plan. You can have a family with up to 10 on the plan, which is a lot. I've seen it, by the way. We had an agent that enrolled his entire family. It's a lot of kids. And all your options are here. So say you just have a client only. Again, all of these premiums are going to be automatically reflected per the zip code that you input in the beginning. Also, when you get here, if you have a question about a dentist being a network or not, or if they're looking for one that's a network, you type in the zip code.
76001.
Oh, close.
You're good. Yep.
Close. There we go. So in that area, right, in the DFW area, huge network all over Texas. So you can have
That's fantastic.
Access points, and that's within 25 miles, right? So if you hone it into 5 miles or do it by specialists, whatever it is, the network is huge. And again, to go back through that in-network discount, the negotiated rate is the biggest piece. All right, so going back, same for vision. We don't have to walk through that, but feel free to play around with it. If you have a question about the plan, and this is why I say you can really navigate everything directly from here. You can look at all the co-insurance levels that are covered. If you have a question about a specific procedure, maybe, you can click View Complete Plan Details, and it'll have all the product details, all the limitation exclusions right there for you. Try to make it as transparent as possible. So your client decides on a plan, click Select. You can view more about the NWFA directly from here. Say you're looking at the complete plan. Break it down there, maybe. My computer doesn't like me today. There's a breakdown directly here that you can view all of the info at and all the benefits that come with it. So feel free to poke around there. There are several selling points with those benefits. All right, so the application. Let's look at how the application is. So again, very straightforward, basic information and a way to contact you. So if there's a lapse in payment, or we have to get a hold of you or your client for whatever it may be to help keep them on board, then we have a way to reach out to them. So basic information, you can see we don't ask for a zip or a social security number or an I-10. No citizenship status info is required. No health questions. It's either ACH or credit card to process the premium payment.
Hey Ken, one quick
Yes, sir.
second. So you said someone who has an I-10 can get this as well?
Correct. Yeah, we don't ask for anything to do with citizenship status.
Okay, that is fantastic. That's awesome. Thank you.
I agree. Yes, sir. So we'll just click submit here, and this is the last screen. That was it. That's the application, right? So we'll overview the basic info that was submitted. The other way, if there's any typos, we can go back and fix it. Effective date's always going to default to the first of the following month, up to 1 month out. And your billing date is going to default to the day of the enrollment. However, you can move that around, right? So they don't get paid till next Monday. And you set it out to the 25th. As long as it's before that first of the following month, then they'll still be on board and effective on the 1st. So you can set out to the 31st if you'd like. Confirm, that's it. So that's the application. That sends the email confirmation to you as the agent that you've made a sale. And the client will also get their email fulfillments with electronic ID card. That'll initiate the hard copies being sent in the mail within 7 to 10 business days. And that really starts that timeline for the client, right? That retention timeline, and where we touch base on their birthdays, anniversaries of the product, just to make sure we help you keep them on board.
Man, that is fantastic. One more thing I wanted to touch base on, guys, is this is level commission. Okay. So, whether this is a year, 2, 3, 4, it does not decrease. With a lot of commissions, they're going to, pay you a commission that's going to be a higher first year and a much lower second year. With the NCD, it's a level commission. And we don't discuss commissions on this, but get with me. I think you'll be very pleasantly surprised what their levelized commission is. And I had a question. When you set up to 10 people on the family, a family can be more than 10, correct? It could be you just use 10 as a number, correct, Ken?
Yeah, that's 10 dependents. My bad.
Okay. Okay. If you have grandparents living in the household, can they be considered on there as well, or would they need to be there on their own plan?
They would need to be on their own plan. Dependents would be 26 or younger.
Gotcha. Thank you. Okay.
Yep. Yes, sir.
Yeah, but yeah, this is like I said. I mean, looking at all the different possibilities. Everyone, go out if you want me to. I mean, I will help you get a $10,000 dental pen for you to wear around at your events. Asking about my $10,000 dental plan. We're trying to create conversation. This is what we're trying to do. This is such a strong focus on what we're doing. The network, 10% major first year, $100 lifetime deductible. This is just a tip of the iceberg on what the possibilities are with this. Debbie, the $17 is for the association. So you saw the dental premium and the association equaled $88. That's what the total premium was. So that's what was on that last screen. You can't separate the two, but those two are combined. It was just showing a separation of what each one was.
Right. And just to touch on that also, we legally, MetLife requires that we, break it down, at least on the application.
Sir. Yes, sir.
But yeah, that again, everybody, that association is embedded in the cost of the dental. So it's not an add-on. Yep.
Correct. But yeah, these are, like I said, get with us, get with your regional director, get with your upline. Like I said, it's a great system. They have multiple levels, and like I said, whether it be the dental, the vision, when Kim was talking early on about their member focus and agent support, how fast they answer the phone, what they do, their 4.9 Google reviews, almost 3,000 people have submitted reviews. That's phenomenal. That's just a great asset to them on how quickly they do their business and how fast they get back to their people, and makes our lives a lot easier because they're not calling us complaining. So that's
Absolutely.
just another something great.
Yeah, and hey, if you're not contracted, you get with Joey for that. You will be ready to sell within 24 hours, right? So very
Fantastic.
streamlined licensing process. If you're licensed in a ton of states, we pull those licenses for you into our system, and you'll be ready to rock.
Awesome. Anybody have any questions before we let go here? Okay, like I said, pretty straightforward. I always pick up a few things. I had forgotten initially about especially the core, the $100 lifetime deductible. I love the new Elite plan. It's a lower premium. Even $5,000. Someone doesn't want to pay $88, but $50 is more palatable. So, like I said, with what they have, the MetLife network, everything they have, there's strong support, both member and agent, levelized commissions. That's why I chose them as one of our preferred providers, and hopefully we continue to strengthen it and move forward. So, Ken, thank you so much. I appreciate you joining us today, and you and I will get together soon. And there's no other questions. We will let you go. And everyone, thank you, and have a great rest of your week.
Sounds good, my friend. Hey, thank you everybody for joining.
All right. Thank y'all again. Talk with y'all soon. Have a good one.